Bleeding in pregnancy is one of the most important complaints for us. Whenever a patient with bleeding comes to you, what the things which are start to diagnose the causes of this bleeding? Firstly, we think, is she complaining pain also? And second most important thing is, which is to know is week of gestation. If duration of pregnancy crossed age of viability, then we think about placenta previa and abruptio placenta for the cause of bleeding. What is the thing which differentiate between placenta previa and abruptio placenta? It is pain. If bleeding is associated without pain, then it is definitely due to placenta previa. The definitive management of placenta previa is termination of pregnancy only by cesarean section. That means it never should be normal delivery through vagina. This is for in case of period of gestation has attained 37 completed week at least. That means period of maturity. But if it hasn't reached up to 37th week, then it is best to wait till period of maturity, that is 37th week, until and unless uncontrolled bleeding, letting the patient even in shock. To control the bleeding and impending shock, we have to take some measures. You should add or inject antifibrinolytic agent, as example tinagamic acid. Second is patient should be in totally rest. To maintain volume, start or add any fluid available, as example NS, RL, etc. You should transfuse blood after cross matching, available as soon as possible. Injection dexamethasone to mature to make lung mature. Besides so many routine things, some antibiotics also should be started to prevent infection, to prevent forthcoming infection. Placenta previa means low-lying placenta, that is below the cornu of uterus, either left or right. Most common and normal attachment of placenta is the cornu of uterus, either left or right, but I think this is the cause of most common position, which is left occipito anterior. Now let's focus on another cause of this bleeding. If a conceived patient has bleeding with pain which is beyond the age of viability, then diagnosis would be abruptio placentae. This means premature separation of normal lying placenta. If normally attached placenta is started to separate before labor or during labor,